patient does not need to show a coronavirus test report to get hospitalized. This is what the government has said today in its revised guidelines. Now, these guidelines aim to provide effective and timely treatment to those who are suffering from COVID-19. At a time when cases are rising at an alarming rate, the government has assured that no patient will be refused on any count. The government says that hospitals can no longer refuse patients from another city. These guidelines include some very strict orders for the states and union territories to follow. The government says that any suspected case of COVID shall be admitted to the suspect ward of the COVID care center or the dedicated COVID health centers or dedicated COVID hospitals, depending on the case or how severe the infection is. The government has ordered all the states and union territories that no patient shall be refused services in any case. Services here includes medications like medical oxygen, essential drugs, even if the patient belongs to a different city. The guidelines also say that no patient shall be refused admission to a hospital if he or she is not able to provide a valid identity card that does not belong to the city where the hospital is situated. The government guidelines focus on one very important thing, that admissions to hospital must be based only and only on need. The center has ordered states that beds should not be occupied by people who do not require hospitalization. The new guidelines say that patients suffering from mild symptoms of COVID shall be admitted to COVID care centers that have been set up in hostels, hotels, lodges, schools, stadiums, etc. The Health Ministry has also said that functional hospitals that are treating non-COVID cases or patients will be converted into COVID care centers only as a last resort. The ministry says that dedicated COVID health centers equipped with beds with oxygen support shall attend to mild cases, and the dedicated COVID hospitals shall offer care and services primarily for those who've been severely affected by the virus. The new guidelines have been sent to all the states and union territories, and they will have to follow these guidelines in their hospitals that are under the central, state government or private hospitals that are treating COVID patients. The Health Ministry has also advised Chief Secretaries of states and union territories to include all of these guidelines in their necessary orders and circulars within the coming 3 days. The strict orders come at a time when India's second wave of coronavirus has led to a massive surge in demand for medical oxygen and other critical medical supplies that are needed to treat COVID patients. Today, on 8th of May, India reported more than 4 lakh fresh coronavirus infections for the 4th day in a week.